The COVID-19 unit at Ephraim McDowell Medical Center in Danville was at full capacity on Friday, and based on local testing, hospital administrators are preparing for a surge in patients. LEX 18's Catherine Collins shows us how.
We've heard public health experts talk about the potential for a fall spike in COVID-19 as temperatures drop and people spend more time indoors. Dr. Chris Petrie at Ephraim McDowell Regional Medical Center says he believes it's already started.
We have already had one point where we've filled up all of our beds and had to go on diversion. I think that, says that we're headed for an uptick and definitely headed for a surge.
For a period last week, he says all 17 of the hospital's COVID unit beds were full with 3 people on ventilators. Tuesday, he says 4 beds were open, but the state has placed Boyle and several surrounding counties in either the orange or red zone. So he's concerned about what might be coming next.
You wonder what are we going to do at the point that, we are full, and are we going to have enough staff to take care of those patients? I think those are the things that worry me the most.
Administrators say they have a plan with more beds available within the Ephraim McDowell Health System at Fort Logan Hospital in Stanford and James B. Hagan Hospital in Harrodsburg, plus partnerships with hospitals in Lexington. As for staff, Executive Director of Clinical Effectiveness Jason Dean says a little under 3% of associates have tested positive for the virus since March.
We've got to make sure that we retain our staff. We're talking about that daily to make sure everybody's doing the right thing.
Dr. Petrie says now is no time to let up on precautions.
This is far from over, and we can't become lax.
Especially because what he sees in Danville is part of a larger trend across Kentucky. Catherine Collins, LEX 18 News.